Hi, I'm Dr. Ron Miller of Pursuit Physical Therapy, and today we're talking about hip pain. And I always love it when a patient comes in and says, I have hip pain, I've been diagnosed with hip pain. And that really doesn't tell me anything. So let's dig a little bit deeper and look at three main types of hip pain. And I like to keep things simple. Let's look at front hip pain or groin pain, lateral hip pain or side hip pain, or maybe like a posterior hip pain or even a glute pain. So let's look at anterior hip pain, because each one is going to be different. Anterior hip pain a lot of times is dealing with either a groin pathology or a hip pathology, or you have some sort of hip impingement going on. So this tells me a lot more information about your hip pain and what's the best way to treat it. Now, side hip pain is more of like an IT band syndrome. Many times patients will be diagnosed with like bursitis and stuff like that. But there are cases where side hip pain is referred pain coming from the back, more specifically that L5-S1 area, which is the most common area that causes back pain or lateral hip pain. So again, you have to be aware of this. Just because you've been treated for lateral hip pain or getting an injection or treated with some stretching or foam rolling or something like that, if you're failing treatments, it may be a back problem that's causing your lateral hip pain. And then how about the last one, which is posterior hip pain or a glute pain? Now there's many causes of this. If we just list them, it can be coming from your low back, it can be an SI joint pathology, it can be a piriformis syndrome, it can be a tendinopathy, it can be an internal hip problem like an osteoarthritis or maybe a posterior labral tear. So as we just named off 5 things off the top of my head, posterior hip pain is more of a complex condition and you have to solve the cause of it. Not all posterior hip pain is piriformis syndrome. Many times people will just come in, I have glute pain, I was told that it's piriformis syndrome. Very rarely is it really piriformis syndrome, it's something else. So today we've kind of gone over the diagnosis of hip pain and broken into 3 categories. And this 3 category system will kind of tell you a lot more information of what is causing your hip pain and what's the best way to treat it. So if you're having one of these types of hip pain, and if you have questions or concerns about it, or if you failed multiple treatment approaches, give us a call or visit us at pursuittherapy.com. Thank you.